Hello, dear physician community, scientists, researchers. My name is Prashant Muthukrishnan. I'm a pulmonary critical care attending at WVU Medicine, West Virginia, and I've trained at institutions including UPMC, went on to do fellowship in Iowa and Cleveland, and have worked in New York, Albert Einstein. I have been involved with integrative approaches at the American Thoracic Society, and it's my privilege to be part of this proposal, and I hope to hear from you. The topic is proposal for body-mind metabolic phenotyping research, and I hope this will continue to motivate drug development projects across various fields within pulmonary medicine and beyond. My aim is to categorize cohorts of asthmatics or COPDers or ILD patients based on a very scientifically sound system that describes body type, mind type, and metabolic phenotypes as a scoring system, just like we have scoring systems for identifying risk factors or subtypes of other populations in studies, including cardiology, PE risk stratification, and so on. My hope is to reclassify these patients beyond what we know currently based on biochemical parameters such as eosinophilia, allergic versus non-allergic, etc. And as part of ATS Integrative Group, we just presented at ATS 2022 in San Francisco our proposal and a brief presentation on what are all the basic definitions that physicians like you should know, so that we can go beyond what we know, within aspects of current technological part of Western medicine, right? So my hope is to connect with you, whether you're part of severe asthma project or obesity asthma cohorts or COPD gene or ILD cohorts. And this is our integrative group, including Tanya and Dr. Asha Deveru, and there's multiple other physicians from all over the country. So some of the basic elemental constituents of our organs, tissues, and cells, they're divided as air, space, fire, water, and earth. Each person has unique proportions of these energies that change in constitution in response to time, season, environment, and consumption of energies. Air and space together is called as vata in Sanskrit. Fire and water together is pitta, and water and earth called kapha. Okay, and we know that energy and matter coexist and they change forms, right? And therefore these energies transform into a form, giving rise to matter, and gives rise to various functions that happen within our body. And these are very similar to humorisms that exist in Chinese medicine, traditional Chinese medicine, TCM, including Roman and Greek forms of medicine from Hippocrates and mind medicine. So, for instance, we know temperaments, including melancholic, sanguine, phlegmatic, choleric temperaments in the behavioral health field. And these arise from the elemental constitutions of the neurotransmission, right? Hormonal systems that form our organ systems. And my main focus for today's proposal is that I want you to look into this phenotype analysis questionnaire, and I would like you to share this as part of a research project with your patients. And the patients will fill out this questionnaire to figure out what category do they score more under. And this will help us define these patients as either vata predominant, pitta predominant, or kapha predominant by baseline, and then we go on to ask them questions about where they have imbalances or problems, more symptoms, pertaining to either neurotransmission or hormonal imbalance systems versus lubrication and structure, right? Just like we have different forms of elemental constituents in foods, including carbohydrates, proteins, and fats, different parts of our human organ systems are made of different elemental constituents. So Deepak Chopra is one of the examples of online dosha calculators, and I endeavor to you to spend some time on this. This is an example of one questionnaire, and different lengths and details of the questionnaire are available online, and I hope this one from Chopra, it might be a reasonable start. So an example, you can do this for yourself. Frame, are you somebody who's thin, lanky? You may have been Vata predominant earlier in your life, and over time you may change into Pitta and Kapha over time based on the consumption of energies over time. Are you a medium build, good muscle development, or are you large, round, stocky build, broad? That'll go along with Kapha. Weight, are you lower in the spectrum of body weight, or more moderate, easy to gain or lose weight if you put your mind to it? Whereas are you heavy? I gain weight easily and have difficulty losing it, right? Eyes, my eyes are small and active. I have a penetrating gaze when it comes to Pitta, right? Because fire is predominant, or hormonal system is more predominant there. I have large, pleasant eyes. Complexion, skin is dry, rough, or thin. My skin is warm, reddish in color, prone to irritation, like for example acne, right? These people are prone for acne. That's an imbalance, whereas the skin being warm, reddish in color, prone to irritation, it's a baseline tendency. Whereas Kapha people their skin is thick, moist, and smooth because they're very lubricated, right? Hair, my hair is dry, brittle, frizzy. My hair is fine with tendency towards early thinning or graying. I have abundant oily hair, thick hair. And these are very important to understand as a baseline phenotype analysis, so that we move on to their imbalances in the next slides, and I'll show you that. Joints. My joints are thin and prominent and have tendency to crack. My joints are loose and flexible. My joints are large, well knit, and padded. And you may wonder, why does this have anything to do with asthma? Well, we know that asthma does not belong to just the respiratory system. It belongs to it is a systemic disease, right? And therefore different parts of our body communicate with each other, and people who have asthma also have other symptoms, and we tend to just document that as asthma seems to be associated with IBS, or seems to be associated with risk for osteoarthritis, or rheumatoid arthritis patients are at risk for ILD, right? And they are not just mere associations, but there is an underlying common ground that is formed in the neurohormonal and immune system, neurotransmission or hormonal endocrine feedback loop, right? These are the fundamental mechanisms that give rise to different symptoms in different organ systems, and you happen to have predominant symptoms with respiratory system when your patient comes to the pulmonary clinic, but you don't tend to pay attention much to their IBS symptoms or their rheumatoid symptoms or joint symptoms, etc., right? Or their hair loss. They don't complain to you about the fact that they have frizzy hair, but these are important to understand so that you first understand your patients, and then we go on to the next step where we identify certain plant-based products, plant products that are derivatives, right? And these are actually used in drug development, and I'll show you some examples. So moving on, sleep pattern. I'm a light sleeper with a tendency to awaken easily. I'm a moderately sound sleeper, usually needing less than 8 hours to feel rested. My sleep is deep and long. I tend to awaken slowly in the morning. Body temperature. My hands and feet are usually cold, prefer warmer environments. Whereas Pitta, I'm usually warm regardless of season and prefer cooler environments. Whereas Kapha, I'm adaptable to most temperatures, but I do not like cold, wet days. And you'll see a pattern, right? Somebody who's already Kapha is already cold and wet, and that's why they don't like more of the same. Next, temperament. I'm lively, enthusiastic by nature, very flexible. I like to change. They cannot stick to one thing. They love doing 10 things at the same time. Whereas Pitta, I'm purposeful and intense. I like to convince people. I lead, groups. Kapha, I'm easygoing and accepting. I like to support. I'm down to earth, grounding. Next, under stress. Vata people are anxious, become worried, whereas Pitta people become irritable and aggressive, angry, right? Whereas Kapha people become withdrawn, reclusive. So each of these guys, basically how you're going to score them is you give them a 5-pointer if they most accurately represent me, Vata, right? 5, and then you basically give 3 and 1 to the other 2. Whereas if Pitta represents you mostly, then you give 5 for Pitta, and then you figure out whether Vata gives maybe second really, and then Kapha third, right? Because not all of you are completely Vata. Say you can't give yourself a 9-pointer. You may have a little bit of Pitta and Kapha, but we're trying to frame a spectrum here, because nobody is purely Vata or Pitta or Kapha. And a total score of 90, right? 10 points of 9, and you get yourself points somewhere like 50, 30, and 10. Okay, and where does this come from? Well, the universe and the human body cannot be separate from each other. The environment is very, very closely knit with the human body and its functions. And these 5 elements, air, water, space, fire, earth, also make up the same universe. And therefore, when the outside elemental constitutions are towards, for instance, Pitta during the summer, then we are expected to do things that are opposing to the summer, which is cooling in nature. And when you do not respect the elemental forces or influences from the environment around you, that's when we have symptoms, when you don't pay attention to it. Allergy season, right? And there's coldness, wetness, there's fluctuations of temperature, right, between in the start of March, April, during spring transition, and that's when we have more allergy seasons. So these are some important facts to pay attention to. And I'll defer to you to pause this video right here and actually go through this slide completely. This will make a lot of sense as you understand the human body's functions from elemental constitutions. And because this is very important, I'm going to tell you some of these drug developmental constitutions in plant products that'll be pertaining to either Vata, Pitta, or Kapha predominant types of asthma or types of ILDs. Vata, most important is neurotransmission, both peripheral, parasympathetic and sympathetic nervous system, and the CNS. And we know that trying to amplify or at least bring a balance between the autonomic nervous systems, parasympathetic and sympathetic arms, which is flight and fright versus rest and digest. We want a balance towards each other, right? And that's when we create health. Signs of imbalance in Vata include you have trouble falling asleep, you wake up early in the morning, cannot get sleep, you can't go back to bed. When disturbed, you become anxious and fearful, your memory is not good, you have pains without any known functional disorder. For instance, that's a classic of fibromyalgia, right? And we don't necessarily see fibromyalgia only in patients who are thin. You can be a Kapha predominant person overall. You can be a big build person, but if you do not pay attention to the functions of Vata, neurotransmission, and if you are somebody who is aggravating your motility, your your sensitivity, the amount of time that you spend on unpredictable schedules, etc. Things that aggravate neurotransmitter stability, those patients are likely to have vata predominant symptoms, including fibromyalgia. And we know vata predominant asthma may be associated with fibromyalgia when you have a clinical history taking. You physically tire easily, you're underweight for your height, your digestive strength varies a lot, right? Flexible digestion or flexible appetite. You often have indigestion and gas and bloating. You experience tension headaches. You experience constipation often. You're more sensitive to stress than others. These are some of the questions that you're eliciting from patients, and I want you to understand that this will be, part 2 of the questionnaire that I would like you to ask it, the research population, to elicit whether they have a baseline phenotype of whether vata predominant or pitta predominant and kapha predominant, and then you go on to understand whether right now in this past few years or months, which part of your phenotype, baseline phenotype, is becoming exaggerated or out of balance. And accordingly, I will be giving you certain lifestyle modifications and certain plant products that will potentially be usable as future drug development discoveries, right? So dry skin, feeling shaky and unsteady, and so on. So that's for vata. Pitta dosha, hormonal and enzymatic activity in circulatory constitution, is usually represented by pitta. You get hot easily, you have premature graying of hair, right? Singeing of hair. Imagine you fire and hair singes, and that's a classic of chronic hyperexcitation of the fire activity within our body, the hormonal enzymatic activity, right? We often have skin rashes, acne, right, are very common. Agitated anger, sweat has a strong odor, heartburn, ulcers, right? Reflux, blood disorders, bloodshot eyes. Digestion is irregular, become very emotional, quick to become irritated, and so on. You cannot skip a meal, right? That's the kind of person who is pitta. Whereas, kapha people, they're like, I don't eat anything, I still put on weight. That's classic, right? You're overweight for your height, the kapha, usually, not all the times. When disturbed, you become depressed. You often experience lethargy and dullness, slow digestion, sinus congestion, classic, wet asthma, more mucus predominant asthma as an example, slow to learn memories, oily skin. So these people you see are kapha problems. Structural integrity, lubrication, and lymphatics. These represent kapha. And we know that Ayurvedic biological clock is very much the same thing as the circadian rhythm that recently got a lot of attention when the Nobel Prize was given to Jeff Hall and colleagues when their studies on effects on metabolism and chronic disease were associated with the circadian rhythm. And you see that different parts of the day, you have different predominant phenotypes. Vata, part of the day, kapha, part of the day, and pitta, part of the day. And therefore, you are supposed to do things that are opposing to the time of the day. So, if the pitta time of the day is already high, then you're supposed to do more of vata and kapha activities. And these are available online. An example, eat your biggest meal at noon. The digestive fire is at its top, right? And so on. Next, scientific reports. We find that in PubMed, you will see wonderful publications that have shown that these phenotypes do not belong just to the phenotype, but also down to the genotype, right? So we have principal component analysis of 52 SNPs that showed significant difference between these V, P, or K constitution, irrespective of ancestry, when these cohorts were studied. And they even identified certain parts of the genome that had Pitta phenotype, for instance, the PGM1 region. And so it goes beyond epigenetic makeups. It's more down into the genome. And I've given you some, lead into the Vata, Pitta, and Kapha phenotypes as to how they are at baseline and what happens when they go out of balance, and how can you bring Vata back into balance. For example, routines, preventing unpredictabilities is very important for Vata. Grounding environments. Ashwagandha is a great example for a drug that is becoming very famous, and very soon you will find that the marketing industry is trying to look into the actual chemical ingredient that's active within ashwagandha, just like curcumin from turmeric. Pitta, similarly out of balance. These patients are very usually angry, acid reflux, migraine headaches, and you will see even OBGYN problems that are very, very strongly associated with types of asthma. For example, endometriosis, very, very common in Vata predominant asthma, dry asthma. Dysmenorrhea or menorrhagia, excessive bleeding, etc. Common in Pitta predominant, patients who have respiratory diseases. Kapha predominant, fibroids, polyps, PCOD, very common, along with asthmatics, and COPDers who are on the thinner side, who've lost a lot of weight from COPD cachexia. You'll find that they have a past medical history when you go look into their gynecological history of endometriosis and similar diseases. So paying attention to the organ systems, how they interact with each other over different age groups, how the imbalance or the amount of insult or lifestyle dysregulation has accumulated over time manifests as diseases in the GI system, in the respiratory system, in different age groups. Gallbladder disease, very common in Kapha predominant and Pitta predominant, or imbalances to Pitta and Kapha. So, and examples of what you can do to bring back Pitta into balance. Avoiding spicy, sour, acidic foods, reducing stress in daily life in general helps all phenotypes, but trying to cool down, more playful sport rather than competitive sport is a good example, right? In simple words, opposing fire is what you need. So which is basically trying to cool down the fire in the form of the activities that you do, or in the form of the approach, the mental approach that you have. Kapha, earth and water, oily skin, sinus congestion, nasal predominant symptoms, lethargy, dullness, lymphatics, right? Bringing Kapha back to balance, staying stimulated, trying to stick to the timeline of the waking up cycle and going to bed, challenging yourself and exploring new things rather than sticking to norms and routines. They love to sit, they love grounding activities. So instead, be more aerobic activities is predominant. Avoid being the martyr. You don't have to, shoulder all the responsibilities, right? Because you're grounding, you are down to earth, and therefore, instead of that, you have to share the responsibilities. These are some more, daily life approach to these phenotypes. And famous personalities, Vata, for example, Audrey Hepburn, classic. Pitta, John F. Kennedy, Jack Nicholson. Oprah for Kapha, right? And there are specific food tastes that are appropriate for these phenotypes, and I need you to pay attention to these. And this is what goes into understanding carbohydrates, proteins, and fats constitution in your food. Sweet, salt, and sour is best when taken in quantity for Vata predominant. Now, when I mean sweet, it's still important that you understand that this is naturally sweet by nature rather than adding processed foods like sugar, etc. Sweet by nature includes things such as rice, potatoes, sweet potatoes, melons, watermelons, fruits that are naturally sweet. Salt by nature, rather than adding salt, these are fruits and vegetables, and grains and seeds and cereals that are salty by nature. Okay. Similarly, bitter, pungent, and astringent is very good for kapha people, right? Whereas sweet, salt, and sour is bad for kapha people. Understand that. You will see that sweet, salt, and sour, and bitter, pungent, and astringents are actually the overall the 6 tastes, and they're completely opposite to each other, vata and kapha. Whereas pitta is a combination of both vata and kapha, somewhere in the middle. Sweet, bitter, and astringent are pacifying for pitta, and these are the recommended tastes of foods. And this goes into the choice of the diets and future drug developmental strategies. So my hope is to ask you to take this over and form this questionnaire and distribute it to your asthma cards or other ILD and COPD cards, or even volunteers within your own clinic or employees, and potentially bring in spirometries and track spirometries over time when you've given this information to these patients and you've given basic do's and don'ts, and potentially share some simple, safe plant products that are safe and helpful for their own phenotypes, and see whether over time their symptoms, your asthma control score, your spirometries actually get better over time. That's my main goal here, or even peak flows. And not just respiratory symptoms, but also how their control of fibromyalgia is, or how their acne control is, how their gynecological history changes over time. And that's my goal. So assessing the prevalent use of daily and seasonal Ayurvedic lifestyle routines in asthmatics that are well controlled versus poorly controlled is a great example of a starting study for this. And I'll show you here how many plant products we have that are actually used for drug development. Okay, you see here, morphine, opiates, right? Anti-cancer agents, paclitaxel, cyclosporin. Almost all of our medications come from plant derivatives. Digoxin, right? Taxus species giving paclitaxel, right? What else? There's one more website right there. So I'll show you this one right there. Yeah, digoxin, right? And then I'll show you something. Allantoin, cell plants. Atropine, right? Atropa belladonna, that's something that you know of. Caffeine, of course. Camphor, cocaine, codeine, right? Very commonly used. Colchicine, yes. Curcumin, now. L-dopa, digoxin, etoposide. So what I'm trying to impress here is that understanding Ayurvedic herbs from India, China, all over the globe is important to be able to give drug development companies, pharmaceutical companies, the right information so that you can use this for future drug discovery, right? Turmeric and ashwagandha is very, very amazing for the vata predominant phenotypes, very grounding, right? Licorice is also very, 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 very helpful. So trying to figure out who your patients are and sharing with them such simple, safe products is very important. Daily routines and seasonal routines are some of the important lifestyle modifications that help balance the vata, pitta, kapha, neurotransmission, lubrication, as well as hormonal systems for all phenotypes. And I presented actually at ATS in 2020 how understanding stool patterns, whether there is something called the Bristol stool chart, type 1 from the spectrum from type 1 all the way through type 7, where type 7 is more liquidy stools, whereas type 1 is separated hard lumps. Type 3, type 4 is right in between, where the stool is much more formed and well formed, right? And I found that more severe asthmatics had both extremes of stool types rather than in the middle. And so therefore severity asthma seemed to have a correlation between along with whether they have stool symptoms or not. So, and we know IBS has a very strong link with respiratory diseases, and that's because, let me tell you, Ayurveda understands that all of the insults to our lifestyle are the biological clock, circadian rhythm, starts at the gut. The gut holds much of the immune system neurotransmission with the rest of the body, and that's because the enteric nervous system is very, very, very strongly knit into the rest of the organ system communication in the form of neurohormonal transmission. And that's why we see IBS symptoms very commonly in patients who also have other symptoms, because asthma starts in the GI system and actually manifests later in the respiratory system. And that's why we see that certain foods that you eat are forming allergic triggers for your asthma, or they form allergic triggers for your hives examples, or it can be also inhalational allergens or triggers. Wonderful whole system Ayurvedic intervention, single arm study, right, published in ATS. And basically what they've done is these are the 5 different modalities of modifications or treatments, including certain medicines that are plant products, mild laxatives for cleansing, oil massage to improve the lubrication system of the body, and giving fat molecules to form the neurotransmission of nervous system, steam to amplify the temperament of the body, to amplify the fire content, to increase the metabolism, basically pacification drugs to pacify vata, pitta, kapha according to their level of imbalance, and immunomodulatory medicines. These were the treatments given to a group of patients, asthmatics, and before giving the treatment, they've already identified these patients, whether they are vata predominant, pitta predominant, kapha predominant asthmatics. And before and after treatments, you see that there is a statistically significant difference in FEV1, FVC, 76 to 85. That seems to also be crossing the minimal clinically significant marking, right? MCID, peak flow changes, ACQ scores, and look at that ACQ score, 2.64 all the way down to 0.4, right? And so basically you see that they not just identified respiratory parameters, but also cytokine level information, Th2 reduced, Th1 reduced, pro-inflammatory reduced, and immunosuppressive interleukins went up. So this is very profound information that I need to share with you, and I hope that this will encourage you to take one cue out of this paper to broaden your horizon of approach in asthma or COPD or ILD or other subjects. And they've also studied these patients before and after, including IgE levels. For example, see kapha predominant 442 all the way down to 282, and so on. So those are some important. Now, not just based on respiratory symptoms, but we also found out whole genome expressions were correlating very strongly with certain phenotypes. For example, K, P, and V are classified here, and they've identified certain biochemical markers. For example, cholesterol metabolism goes along very well with Pitta, and similarly with RBC counts. along with the Pitta predominant phenotypes. And similarly, they've identified different parts of our cellular mechanisms to specific phenotype parts of the Vata, Pitta, and Kapha. And these are very, very strong data, right? And so this was an example of the questionnaire that I wanted to show you in the first place. And there is more than one format. And in Ayurveda, we also use pulse diagnosis, much more profound than Western medicine, where we actually look for derangements in neurotransmission, hormonal systems, and structure and lubrication. But this is beyond the scope currently. We'll get to there eventually later. So these are examples of food items that you can share with your patients once you are getting them through the first phase of the research study. After identifying their phenotypes, these are some useful tips to share with the patients, and I'm hoping that you will share these tips and then follow them over 2 to 3 months and identify whether there's any improvement of symptoms or just a better understanding about their own symptoms. And I have a beautiful case report to share with you nicely how I've done this. For one example, I've published this on PubMed, and you can look at your own leisure. And we understand that Vata, Pitta, Kapha, these organ systems that I've told you about, neurotransmission, hormonal and enzymatic feedback, and structure, they form the middleman between the environment's influences or the activities that we do and the microbiome. The microbiome gets very, very profoundly influenced by our actions. And sticking to the circadian rhythm is very key. And when the circadian rhythm is dysregulated, then these neurotransmission or hormonal transmission also gets dysregulated, and that's when the microbiome gets dysregulated, leading to their dysregulation, leading to production of cytokine storms or inflammatory cascades that lead to chronic disease. So these guys, the microbiome, are actually the middlemen that's causing all these symptoms in us, because they are the ones that are going through these dysregulations from our actions, or not just our actions but also from genetic predispositions from the genome, from the sperm and the egg of the father and the mother, if they've had a lot of dysregulation during their own lifestyle. So, and that's what we call it as epigenetic influences that get carried on from generation to generation, not necessarily in the genome, but actually epigenome, which is markers on the genome that switch on and switch off certain diseases, right? And we know the gut-lung axis is very strong when it comes to the association between how the GI system contributes to symptoms in the respiratory disease. So finally, ending slides. So my hope is that you will talk to me in these next few weeks and be interested in creating a study proposal. Right? I'm here to help you out with basic information that is necessary from the Ayurvedic standpoint, and you may be leading the project in your own area of expertise. And my hope is that you will entertain the Ayurveda Dosha questionnaire, phenotype questionnaire, and it's also westernized. When you look up online, it's very much westernized. Instead of using Vata, Pitta, Kapha, they've made it into westernized language. And you share this with your patients and create a proposal for a study. Along with this, we'll study whether it is respiratory biomarkers, pheno, eosinophils, or spirometries, or symptoms of other chronic diseases, including fibromyalgia, etc., ACQ scores, and so on, right? And then we give them basic do's and don'ts according to their phenotype, according to their predominant imbalance right now, and give them seasonal routines, daily routines to follow, and track them over 3 to 4 months, right? And then if this comes back as a positive study, then we go to the next stage, saying that we have identified these patients cohorts within asthma cohorts that we thought were severe asthma or eosinophilic asthma, and they responded to Fasenra, or they responded well to Dupixent, and so on. And then we add on this to the arm, right? Imagine Fasenra plus having all of this versus just Fasenra. It's much powerful. And then this will also give you future drug developmental proposals to the pharmaceutical companies to say, hey, we have Vata predominant asthmatics, right? These guys are more neurotransmission um, dysregulation predominant phenotypes, and therefore let's figure out what's there in ashwagandha, for instance. Let's figure out what's the chemical component, and similarly licorice, or all the herbs, the plant products, right, that are coming under the category of Vata pacification drugs. And you can go online and read through what are all the plant products that are helpful for Pitta predominant and Kapha predominant, and this will give you a strong background to work with pharmaceutical companies when you are trying to figure out what drug molecules to study. That's my hope. And along with this, of course, adding on lifestyle exercises, including rehab, and daily relaxation techniques, including meditation, go a long way in asthmatics. So, combining this with lifestyle medicine will be a great package for our patients, and also for the NIH when you submit for protocols. I'm sorry that I've taken a long time, but I hope that you will give me this opportunity to work with you, and I hope this will support ongoing and future drug developmental strategies with various pharmaceutical companies. Thank you so much.